Hi everyone, it's Mrs. Fitz from the STEM Connection, and today, our STEM professional we have with us today is Mallory Hotkiss. She is a registered nurse. Hi Mal, thanks for joining us today.
Hi, thanks for having me.
Yeah, we're so happy you could be with us. So can you tell us a little bit about what your current job title is and what you do?
Sure. I'm a registered nurse at a hospital, and I currently work on an observation and a surgical unit.
All right, so what exactly do you do on an observation and surgical unit? What kinds of things do you do?
So it's a little bit of everything. We take care of lots of different patients. On the surgical side, we take care of patients before or after surgery, get them ready for surgery, and take care of them right after to make sure that they're healing and not in too much pain. And then on the observation side, we take all sorts of different patients. Sometimes when patients come to the emergency room, we're not quite sure what's going on with them, so they get sent to our unit so we can do a little more investigating and tests or lab work or more observation of them to make sure we can figure out what's going on with them. And then sometimes we kind of know what's going on with them, but they just need a little bit more time with some medication and a little bit more care before they get to go home.
All right, so a little bit of everything, so that's kind of interesting. So you work in a hospital, but I know that there are nurses that work in lots of different places. Can you share with us the other places where nurses can work?
Yeah, nurses can work anywhere. So they can work in doctor's offices, they can work in schools and prisons and community health centers, even at summer camps, and they can work with police officers and forensic nursing, and you can even work on cruise ships. So anywhere that someone could possibly get sick or injured, they might need a nurse.
All right, lots of different options. And I also know just from a little bit in what I know that there are kind of different kinds of nurses, some different based on kind of what level of schooling or what kind of courses you took or different certifications that you have. Can you tell us a little bit more about the different types of nurses?
Sure. So I'm a registered nurse, so I went to school for 4 years. You can be a registered nurse in as little as 2 years, depending on where you go. You can also be a LPN, which is a licensed practical nurse, which is just 1 year of schooling. Or you can do jobs that help out nurses. So medical assistants, certified nursing assistants, and patient care technicians. And that takes a little bit less schooling, but are super important and very important members of the healthcare team.
Nice. I like when there's a lot of different options. So kind of no matter where you are or what your kind of post-high school looks like, that there's a lot of different options if you're interested in nursing. So how did you know you wanted to be a nurse? Kind of, when did you figure that out?
So I always knew growing up that I wanted to do something with people and to take care of people or help people, but I wasn't quite sure how I was going to do that. So I was always really good at science and math. So I just was thinking one day, and then I got sick and went in to get a checkup to figure out what was going on. And the nurse I was working with just was really great at trying to figure out what was wrong with me. She was like an investigator. So I really liked that. And I was like, I think I could do this. This seems fun and a good fit.
Nice. I'm just kind of looking here. So when you are at work, what does your day kind of look like? How do you spend your time?
So it's very busy, a lot of time on my feet. So I have a set of patients that I work with, so I'm always assessing them. So looking at them, finding out what their symptoms are, and working with doctors. I give medications. I do procedures to kind of help figure out what's wrong with patients. I draw labs, and I work with the whole healthcare team to get these people as healthy as I can.
Nice. So here in Indiana, and this is something we do with all of our STEM professionals, in Indiana we have our employability skills standards that we kind of work on and help kids develop throughout their years in school. And I shared those with you kind of before we got started, but here those are for anyone who might be kind of watching and wondering if you haven't seen those. So which of those skills, can you pick out a couple of those that are really important to be successful at your job?
Yeah, there are a lot of those that we need. One is effective communication and collaboration. We work with a whole healthcare team, doctors, other nurses, pharmacists, physical therapists, the patient care technicians. So we need to be able to communicate with them and help advocate for the patient to get their needs met and to make sure that they're safe and being well taken care of. And then also time management. It's very busy at the hospital. There's always something going on. So you want to make sure you're prioritizing and keeping on track and organized with the tasks of the day.
Right, thanks. And then the other thing that we always ask kind of our STEM professionals are, what sorts of technology or tools do you use for your job?
Lots of different tools, but the ones that I use probably most often, thermometer, and check patients' temperatures, see if they're getting fevers, stethoscope, which will help me listen to patients' hearts and lungs and their belly, make sure everything's working properly, and blood pressure cuff that checks patients' blood pressure to make sure that their heart is pumping blood throughout their body effectively. And those are all kind of vital signs that we check on patients. It gives us a nice snapshot of how the patient's doing right then.
Yeah, so probably a lot of kids that are watching have had those same sorts of things done when they've gone in for their checkups at their doctor's offices. Kind of usually that's the first thing that happens, is they get their height and their weight and their temperature and their heart rate, and get checked for breathing and all that. So I think that's pretty hopefully familiar to some of those that are watching. So you talked about using that thermometer and monitoring for fevers. So can you tell us a little bit more about why people get fevers?
Sure. So our body is most efficient at 98 degrees, but also a lot of bacteria or viruses also kind of like that temperature too. So our bodies and our immune system is very smart. So when we get that bacteria or virus into our body, it raises its temperature to try to inhibit or stop that growth, and to kind of kill off that virus before it makes us even more sick.
All right, so that's very smart of our bodies to be able to kind of try to tackle that on its own without having, before having to use medicines or anything like that. So I was thinking about that, and I knew that you were going to share a little bit about thermometers today. So that got me thinking a little bit about the thermometers that we might have around, and kind of connecting with how nurses use thermometers so much. I went on a little hunt around my house to see what sort of thermometers I could find, and I found one kind of like this in our bathroom. So one that I would use with my family members if someone wasn't feeling well and I wanted to see if they had a fever. I also found a thermometer kind of like this, so looking a little different here, but it has a little dial on it like that. So this is one I found in my kitchen that I might use if I'm cooking, to make sure that the meat or whatever I'm cooking is cooked to a safe temperature for eating. And then I know that outside the house we have a thermometer that's hanging up that can help us know what the air temperature is outside. So that's something that you can do when after you watch this video, is you can go around your house and see if you can find any other any thermometers around your house, or maybe any other tool that you have that you can find that has numbers on it, since that's important. And then it's kind of fun. Thermometers are kind of fun to play with. What I have here is just kind of a mug of some warm water. And right now, if I just look at my thermometer, it's measuring just the air temperature because it's just been sitting out in the air. And if I kind of hold that up for you, you can see that it's just about 70 degrees, maybe a smidge more than 70, about 72 degrees is kind of what the air temperature is. But if I take this and I put it in this mug of water right here, we're going to start to see that red dial is going to start to move up. It's kind of starting to move higher. This thermometer is measuring in Fahrenheit, and it's measuring anywhere from 0 to like 220 degrees Fahrenheit. And as I'm watching that dial move up, I'm seeing that the temperature of my water is at just about 100 degrees now. So that was just water that I got out of the faucet in my house, but kind of fun to watch to see how that thermometer works. So that's something that when you're at home you can do, is look around for thermometers and kind of play with those a little bit, and see if when you move them from the air to some warmer water, how those thermometers work a little bit, or what other tools you might be able to find around your house that you could kind of look at and compare with the thermometer. So thank you so much, Mallory, for joining us today to share with us more about nursing, and we hope you have a great rest of your day.
Awesome. Thank you, guys.